Thank you guys for joining us today. We're so happy to have Vicki Malone here. She is a ovarian cancer survivor. Vicki, how long has it been? How long have you been cancer free?
I was diagnosed in 2013, so I celebrated 10 years this year.
Woohoo! That's a celebration.
Yes.
Well, we have a few questions. The first question I have is just kind of tell me about the story that led up to your cancer diagnosis. So, what eventually led you to go to a doctor that led you to get diagnosed?
Okay. Um, I had a unexplained pain in the groin area, which as I look back, I can say that I had experienced those before, but very randomly, not enough to ever mention to my doctor. Um, Assumed it was just, something to do with the female cycle or fibroids or something. And it happened in the spring of 2013. I had one, didn't think a whole lot about it because the pain would hit and almost immediately go away. That happened twice within like a week and a half to 2 weeks' time. And I just felt like something wasn't right. So I went to my MD and he thought it was possibly stool. I know this is getting graphic, but it's the
It's all
stool.
good. Yeah.
He thought it was possibly stool. And so we treated that. Went back a couple of weeks later. It didn't seem to have any improvement. There was also some constipation during all this time. And thankfully, he did not just say, let's leave it alone for a while. When he didn't know the answers, he kept moving on it, and had no idea what we were going to be dealing with.
Mhm.
So, um,
Um, so how did you decide to use that particular doctor? Kind of, like what eventually led you to the oncologist that you used?
okay, well, that was my primary doctor. And after what he thought was the issue wasn't the issue, I laugh and tell people, he looked at me and said, you're 50, aren't you? And I said, yes, I am. And he said, you've not had your colonoscopy yet, have you? I said, no. And he said, do you want one? Well, does anybody want one? No. I just looked at him and I said, no, I don't want it, but I'm guessing that's going to be the next step. And it was. That came out fine. When I did have it done, I delayed because I was scared. And there was a lot of things going on in my Nathan's lives at the time. We had moved the year before to Knoxville for him to serve as the district superintendent. So, we're still getting settled in. I didn't start working until December. So, a lot of things still going on. By that spring and that summer, you don't want to mess with vacation time and stuff. So, I put that off for a little while. I had the colonoscopy done, everything was good. And so, thankfully, my primary doctor said, we're going to send you to somebody else. And he sent me to a GYN. All that was found there was some fibroids, and his policy on the fibroids were, I don't do anything to them until they reach a point where you can't live with them, because sometimes surgery and stuff will make them worse. As we got ready to leave that office, one of the nurses said, with the blood work that we're doing today, we're running a test that is not one of our basic tests. Because that reading a lot of times will come back as a false positive. So we don't want to do that test as a normal part of our blood work, because we don't want to upset people. And I didn't think much about it, didn't question it, because by this time I was really feeling bad. I was tired. My abdominal area hurt. And then sometimes I'd be fine, and then other times it would hit again, and I would be miserable. So sure enough, that test came back high, and we found out that it was the test that they do for ovarian cancer. immediately they sent me to a GYN oncologist. And he was a little confused for a time, not knowing my symptoms were there, but then I also had some other symptoms that I don't think he had ever maybe dealt with.
Mhm.
I remember Nathan would always go with me to all my visits with all these random doctors. And that was the one day that he did not actually go back in to the room with me. He was out in the waiting room. And the doctor, we talked for a while, and he said, well, I see that we have two choices. The choices would be we wait a couple of months and see if any of the symptoms improve, or we schedule an exploratory surgery and go in and see what we can find. And I want you to be the one to make the decision. He didn't offer for Nathan to come back. I was so really this whole time I was just kind of going through the motions because I was hurting and didn't feel good and tired. And so I was left in that room with these two things to think about. And I started praying. God, I don't know what to do. I'm hurting. I want to quit hurting, but I'm also terrified of just the surgery and not knowing. Even though I was in an oncologist's office, believe it or not, cancer never crossed our minds really. It was just, to me, it was another step to see if we could figure out what was going on. So when he came back in, I felt peaceful about it. And I said, I think we need to do the surgery. And so he looked at the nurse and he said, go get her husband and let's talk some more. I don't know dates. It was sometime in probably 1st of August of 13. So we had the scheduled surgery as exploratory. He decided to do a biopsy and then some more ultrasounds the same day. Even when the radiologist looked at the fluid, he said, I really don't think there's a lot there. He said, I didn't get as much fluid as I thought I would. So everybody was kind of taken back that what was scheduled to be exploratory surgery became ovarian surgery for cancer. It was originally scheduled for about 3.5 hours. It turned into 5 to 5.5 hours, I'm told, because he said, I want to open you up good enough that I can see, scrape every cancer cell that I can visibly see. That we will do chemo because there could be a microscopic cell hiding somewhere that I cannot see. So it was about 2 weeks later, and I was in surgery, and I was in the hospital about a week with all the drains and the pain, having to make sure I was able to get up, and those normal things after surgery that they look for. Really no complications until I got home, and we noticed the incision was beginning to show some inflammation. And we went back in and didn't go through surgery again. He was able to do what he needed to do there in his office. So that's, so I guess I found an oncologist just through steps that my primary doctor sent me to. Felt very comfortable with him. Even after we got into the procedures of surgery and healing and chemo, we still sought second and third opinions. See what other doctors thought. One doctor wanted to do another port and do the chemo treatments through 2 ports. And I didn't feel like that was necessary. I was comfortable with the doctor that we had. And so that's who I stayed with. Another doctor, he said, I would do exactly what your doctor's doing. for you right now. So that's kind of the start of the story.
So, as a cancer survivor, and of course you're 10 years out, that you were talking about the emotionalness of you go in there and you're just like, oh gosh, you're kind of numb. Looking back on that, if you could recommend some questions for maybe like somebody who's newly diagnosed and was in that kind of boat, what kind of questions would you recommend them asking their doctors?
Um, I think the intensity of it, how what all does this involve? Like with ovarian, is it localized to just one ovary, especially if you're younger and there's still a chance of you having children, um, which was not an issue for us. But I do have friends that, because of the age they were when they were diagnosed, they do not have children. Um, so I think, find out a little more than what we did. I just kind of went on what my doctors recommended because I had reached the point of where I just don't feel good. It's time to move on and know what's going on.
Absolutely.
So,
What's some words of advice you would give somebody who is newly diagnosed?
um, cancer's not a death sentence anymore.
Amen.
Um, of course, some cancers are easier to diagnose, and there's every cancer is different. Even compare yourself to another breast cancer survivor, what you went through, your treatments, however, surgery, whatever, it's going to be different for somebody else that has even the same stage, same diagnosis.
Mm-hmm.
So, just because you've seen somebody go through chemo that has had a horrible time with it, um, that's not necessarily you. So, when I tell people my story, I try to remind them that it is different. They can change those drugs. They can start you out on whatever drugs they think are the ones that will work for you. Um, but for some reason, if they're just really dragging you down, making you horribly sick, you need to talk to the doctor about that. I tell people to be aware. Um, Something I didn't know until I actually experienced it. My first treatment, I had an allergy reaction to my nausea drug.
Mm.
Um, Thankfully, I had nurses that were heads up and realized that I was in distress, not knowing what, it was my first time. Didn't know what I was going through. Just thought it was me. Because, when you have a hysterectomy, that messes up all your hormones if they wasn't already messed up. So they were able to change that drug. So I was able to have my nausea drugs throughout treatment. And then the other thing I learned was you can become allergic to your chemo drugs.
Mm.
They build up so much in your body that you can't have a reaction to it. And that did occur with me about 6 weeks from the end of my basic treatments. One of my drugs caused a allergic reaction, and again, I put it off to thinking, "Oh, it's the way I sit in my chair."
Mm-hmm.
And you always try to um, think of why you're going through something, you know. Um, and after you sit in a chair for hours, um, you're going to hurt and cramp. And I had back pains, and a few hours later, after I'd gotten up and moved around, I was okay, and didn't experience again until the next week,
Mm-hmm.
the next treatment. And it happened again much quicker and the pains were much stronger. So that's how I found out that you could become allergic to a drug that you've taken for weeks.
Mhm.
And so, yeah, you just always need to, whatever medical personnel that is near you, just kind of be aware of how you're feeling during a treatment and right after, and uh, be open and talk about it. And the other thing I think when someone's first diagnosed is find a support group.
Mhm.
Find a support group. I didn't have that. It seemed like at the time most support groups were breast cancer related. Um, and I even asked my nurses one day at chemo, is there a support group for ovarian cancer ladies? And she said, let me think about it. Um, and that very day, there was just so many times I saw God working uh, during that journey. That day, a lady walked in to the office, and I'm like, "Well, I don't think she's here to get a treatment. She acts like she knows these nurses very well." And she was a former patient, and she'd come back by maybe to get blood work or something. Um, and the nurse goes, "Vicky, meet Lil. Lil, meet Vicky. You two need to talk." And she walked away and left us. And so we became friends on Facebook, and then she introduced me to another girl, and um, we laughed for a while, saying that we were the three M's because all our last names started with M. Um, and since that time, I've lost Lil. Um, Still have Holly, but I lost Lil.
Mm.
So um, when we moved to Chattanooga, we were very open after we'd been here for a while and shared my story. Nathan shared my story, or our story, in a sermon. And a lady walked up and asked him after church, why do we not have a support group for women? And he said, I don't know. And he sent her to the staff person to help make that happen. And we now have a support group in the church for women only, and it's all cancers. And, it has its ups and downs. And then I was feeling the call to kind of put in place for a men's group. And so that has happened. They're just getting kicked off. And so, both groups are struggling just to let the word get out that we're there and how to reach people. But I think if you ask most survivors and those going through the journey, um, just to have those people that have been there,
Mhm.
um, that you can talk and say things uh, within that group that other people would go, oh,
Yeah, exactly.
yeah, because they think they understand, but you really don't.
No, and before I get to my last question, I completely agree with you. The importance of that's why these videos, starting these videos is just one step to kind of help people hear stories from survivors
Yes,
and feel that kind of encouragement and know that you're not alone. These feelings are normal, and but
exactly.
you'll get through it. Death, it's not a death sentence.
No,
It's not, not always, and we just you just keep pushing through, and you just rely on, there's things that people who've gone through it understand it more than the people who don't. And
definitely,
it's just,
definitely.
yeah, exactly. My last question for you is actually words of encouragement for a person who's newly diagnosed with ovarian cancer or any cancer, but specifically we're focused on ovarian cancer. What would be some words of encouragement that you would share with that woman?
Um, hope, hope for any, and I'm going to flip it, just not from ovarian cancer, but to all cancers, to all those survivors, because to me, from the time you hear the word cancer, you become a survivor.
Mhm.
I think that while you're going through the active part of the journey, consider yourself a fighter, a warrior, but also to know that you are a survivor. You've survived hearing that C word that nobody wants to hear to begin with.
Mhm.
Um, so I think hope, knowing that treatments changes all the time for improvement. I think we can all look back on people 30 years ago and go, oh, it was such a horrible um, treatment for them. And today's treatments they're not fun, they're not easy, but there's new medications, there's new medication to prevent nausea, um, and just be willing to reach out, be willing to let people help you. Um, for me, it was a few different things. It was all the people that I knew that was praying for me, people I didn't know, people that didn't really know me, but might have known Nathan or knew one of my kids. Um, One of the things that I would cling to, and if you don't mind me, I'm going to share this. A few years ago, I got hooked on kind of my God signs being a butterfly.
Mhm.
And we all know butterflies are a symbol of new life. They go through a lot of changes before they become that butterfly. Um, and throughout my journey, even during the times going to these different doctors, walking into the hospitals, um, all these different things, I had my God signs of butterflies. The day I went into the original GYN's office, it was kind of like an L-shaped waiting room, and we were kind of sitting in the point of the L. I had my head down, and Nathan said, "Did you see the butterfly pictures?" And I said, "No." And at this point, I just kind of had my head down, not thinking about anything really, except just being scared. And he said, "Look up." And on the short part of the L, there was a butterfly on both walls.
Mm.
So I felt like I was just kind of surrounded with God's love and protection. First time I walked into the oncologist's office, um, one of the back office ladies that's not normally at the front desk, she was sitting at the front desk, and I looked down and she had a huge butterfly necklace on. Um, the day I had my biopsy done, had kind of two angels there. The anesthesiologist had a butterfly pin on like her name tag or something, and then the radiologist assistant was a former church member that got to stay in the room with me. Um, and then back to the butterflies, getting the elevator, um, different times when I would be just with having test or blood work or something, there would be a butterfly. And then during some of my lowest points, during the treatments I stayed in to protect getting germs from people. I would get a card. I had lots of cards from the people of Holston, along with their prayers. Um, and I would open a card, and people that didn't know I loved butterflies, I would open this card and there would be a butterfly.
Mm.
So if you've got a God sign, you got to be aware of it. And I guess I really didn't realize I had a God sign. I just liked butterflies. Um, so now, even these many years later, um, when I'm kind of feeling down or upset about something, God sends me a butterfly.
Awesome.
Yeah. And, all these years later, thank you, Holston, for being there for my family. Y'all helped me get through it.
Amen. Vicki, thank you so much for coming to share your story. Those who watched, if you know somebody who is just newly diagnosed with cancer, or especially ovarian cancer, please share this video. Thank you, Vicki, for your tireless mission, for your advocacy, and for your always words of encouragement.
You're welcome. Thank you for asking me to be a part of this. And again, anybody that, if you've been recently diagnosed with cancer, just reach out to somebody. You can catch me through Facebook. You can catch me through Natalie. there's always a listening ear somewhere and prayers to be offered.
Thank you so much. And you mentioned it in your interview, but the support groups. If somebody's in Chattanooga, the support
Yes.
groups are Christ United Methodist Church. When do they meet?
Yes. The second Tuesday, no, I'm sorry, we've changed dates. The second Thursday. Right now we're meeting at the church, but sometimes during the warm weather we meet at other places, maybe somewhere to eat, or we've done the river walk. So they can always reach me again, or they can connect to us through the church app, phone call, website. So yeah,
Awesome.
we'd love to have anybody any women in the Chattanooga area, and if they need a men's group, I can connect them to a men's group.
Awesome. Thank you so much, Vicki.
You're welcome. Thank you.